Great. Okay, now. Share my screen. 1 second. Sorry, it's been a little while since I've used it. Well, this is fun. It looks different than I'm used to. Oh, there we go. Okay. All right. Can you guys see this? Thumbs up? Yes? The little kitty cat? Okay, great. Start. Okay, perfect. So, we talk about pillars of health in functional medicine, and we talk about exercise and we talk about nutrition. And, we're in our go, go, go society. What we don't talk enough about is sleep and its vital importance in longevity. And everything plays a role. And these factors are hugely important in many, many processes. And so we'll talk a little bit about the importance of sleep and various dysfunctions of sleep and some tips to improve it. And also, I can talk about the functional medicine approach if we're looking at testing. So what is sleep? It's a natural state of rest, but it's also not just rest. It's actually an active process of detoxification. There are different brain stages in terms of brain waves. There's REM and non-REM sleep. Super important for repair and rejuvenation. So lots and lots of important benefits of sleep. Your immune system gets boosted. Memory and learning are very, very important. Improvements, mood, stress. It even helps your muscle repair and growth. If you think about when you get good sleep, that's the time of the day, the period of the day when your cortisol is low. When your cortisol is low, you are not depositing fat into your muscles. You're actually building muscle strength. Consequences of poor sleep, you felt it, fatigue, irritability, difficulty concentrating, your immune system gets weak. That's when you fall prey to any virus that's lurking. Increased risk of chronic disease. Different sleep cycles and stages. So when we first go to sleep, it's usually stage 1, light sleep. We're transitioning from a wakeful state to a sleep state. Stage 2, we get a little bit deeper. Our heart rate slows down. Our body temperature drops. Stage 3 is a very restorative type of sleep. It's a deep sleep. That's when you get tissue growth and repair. And also that's when you get detoxification of the excess toxins in the brain. And we'll talk about that. That's through the glymphatic system. And then REM sleep, which is a kind of a dreaming, more awake type of state. Lots of sleep dysfunctions. So you can have problems sleeping because of insomnia. So this could be a difficulty falling asleep or staying asleep. And if it's chronic, it becomes, super problematic. Sleep apnea is, you don't notice, the people who have sleep apnea may not notice that they are stopping breathing because they're asleep, but their partners might notice because they're snoring and all of a sudden they are unable to take a breath in. And this happens for a period of time, oxygen levels fall, and the brain goes from a deep sleep to a lighter stage of sleep in order so that you don't die, okay? So that you can take your breath and start breathing again. And so you can't get into that very deep sleep because you are constantly getting awakened so that you can take a breath and not die. This leads to daytime fatigue. It can lead to pulmonary artery hypertension, It leads to weight gain. So if you suspect, because you've had a partner that's told you, or if you suspect that you might have sleep apnea, talk to me and we'll do some testing. Restless leg syndrome, it can be problematic. A lot of people have trouble if they wake up. It can even be pain in general, wakes you up in the middle of the night. You can't get good sleep because you're in pain. So then we have to address the underlying condition. And then there's circadian rhythm disorders. That's people who work nights, shift workers. If you're traveling from one time zone to another, or your internal clock has just been thrown off. Maybe you're not setting a regular sleep pattern, and that can certainly lead to sleep disorders. So there are different dysfunction patterns in sleep. So there's this fragmentation, which is you're waking up multiple times throughout the night. And sometimes that could be from something like, as people get older, especially men with prostatic enlargement, having to go to the bathroom a lot. So what is the underlying cause of this? There's a delayed sleep phase syndrome. So you can't fall asleep at the beginning and you sit there and your mind is racing, racing, racing. And eventually you fall asleep, but then you are shifted. And so when everybody, if you're a 9 to 5 work person and now, the alarm goes off, you are in your deep sleep and you don't get enough sleep now. Or there's non-restorative sleep. So you're sleeping enough, but the quality is poor. And sometimes you can, if people have wearables, they can track this and might notice that their heart rate variability is poor. And this, even though they're trying and they're sleeping, it's not good quality sleep. And so they feel fatigued throughout the day. So, what's the relationship between poor sleep and disease? It's linked to everything. Again, everything is connected. So high blood pressure, heart attacks, strokes, sleep apnea by itself is an independent risk factor. Anxiety, depression, stress. And I will tell you, there is a huge link to Alzheimer's disease, and we'll go through that lymphatic system in a little bit. You can't emotionally regulate. You end up being in a very high fight or flight response. Your parasympathetic nervous system isn't upregulated. Sleep deprivation, as I mentioned before, you have high cortisol, so that leads to obesity, type 2 diabetes. It affects your hunger hormones. Anybody who has worked night shift might notice at 3 a.m., all of a sudden they are starving. And the leptin and ghrelin, which are your satiety and hunger hormones, those are all out of whack when you don't have a regular sleep schedule. And immune system dysfunction. So your immune system ends up not working properly. You have a lower immune response and increased susceptibility to infections. And you also get higher autoimmune issues. So, super important with all aspects of health. Improved cognitive. So there's some research evidence. There's a ton of it. This is just a little superficial glance. There's improved cognitive function. So we find that memories get consolidated during deep sleep, and that improves outcomes in learning. So if you've ever had a problem that you couldn't solve, and you're like, I'll sleep on it. Your brain works on it during deep sleep, and then you wake up in the morning and you might have an aha moment. That is one of the benefits of sleep. So this happens in the background without us literally thinking about it. Emotional regulation, we already talked about that. So we have decreased reactivity to stress. When you are wired and tired, you are jittery. You're unable to have this kind of centering and grounding that can happen when you have good sleep. Immune system boost, we already talked about this. People who sleep less than 6 hours a day are 4 times more likely to catch a cold compared to those who sleep more than 7 hours. So again, strengthen immunity, lower risk of infection. What about metabolic health, weight management? We already talked about leptin and ghrelin and cortisol. So when you are sleep deprived, you are more likely to hold on to the weight. The other thing that happens, thyroid hormone. I generally like to check a reverse T3, and maybe we'll talk about that, individually. And I probably have talked to you guys about it in the past, but that's your body's kind of, like thermometer in a way of how are you ready? Are you ready to go and tackle the world? Because if you're not getting enough sleep, your body is not ready to go. You are going to want to hibernate. And then you are moving your reverse T3 up so that it basically is acting as a brake to your metabolism. And that is just because your body is saying, I can't do this without rest. So it forces you to rest. And so you feel more sluggish. You don't feel like you have the energy that you want to go do your daily things. So, super important. And when you have an upregulated metabolism, then you have a much more regular appetite and you maintain a healthy weight. You also have insulin sensitivity issues when you're not sleeping well. So higher risk, 33% higher risk of developing type 2 diabetes due to impaired insulin sensitivity. So we're talking about lymphatic system. So the brain, during deep sleep, removes waste products. That's when it does it. It's when you're sleeping, and we all have waste products that build up after a day's, living and thinking and problem solving and stress, and those have to be removed somehow. And if you kind of picture it like, if you have a party and you don't clean up after your party, then the next time you try to have a party, you're going to have a bunch of mess. And if you don't clean it up, now it's going to build and build and build. And so that's what is happening with amyloid beta in the brain, which has been linked to like the causative or associative issue with Alzheimer's disease. So it has been shown that while you are sleeping, the lymphatic system flushes out the amyloid beta in the brain. And so low sleep, poor sleep is a really bad prognostic indicator and risk factor for Alzheimer's disease. So 10 times more active is the lymphatic system during sleep than wakefulness. Interestingly, for all you side sleepers out there, that seems to be the best position to improve your lymphatic clearance. So if you happen to be sleeping on your side, that's actually the side also. Sleeping on your side as opposed to your back also improves or decreases sleep apnea based on positioning of the neck. So I encourage side sleeping. All right, so modifiable lifestyle factors, because we do this in functional medicine, we do this in a personalized way. So everybody is different, and so maybe for you it might be a hormonal issue, it might be a stress issue, it might be a nutrition issue, it might be a sleep hygiene issue, maybe you're drinking alcohol late at night or caffeine. These things yourselves, and so let's talk about kind of modifiable lifestyle factors to help to improve your sleep And then if you're not seeing improvements over a period of time, then we can dive more deeply into things like labs, cortisol testing, neurotransmitters, et cetera. So consistent sleep schedule. Shift workers, I'm one of them. It stinks, but you do the best you can to try to go to bed and wake up the same time every day. It regulates your circadian rhythm. Melatonin rises at night before you go to bed, and it has to do with the light outside. So as it starts to get dark, melatonin starts to go up. And if we have a lot of blue light around us, it's going to keep us awake. Nutrition. Diets high in processed sugar and refined carbohydrates lead to a poorer sleep quality. So nutrient-dense foods, leafy greens, nuts, and whole grains. But we do that anyway, right? Because that's healthy in general. Exercise. Exercise has been found to be very helpful in improving your sleep. Regular physical activity. We try not to do it right before bed. Okay, what happens is you are stimulating your sympathetic nervous system when you're exercising. So you're also increasing your body core temperature, and that, pardon me, might make it a little bit harder to go to sleep. But if that's the only time that you can do it then. Okay, I'd rather you exercise than not exercise, but maybe afterwards, find a way to bring your sympathetic nervous system down, improve your parasympathetic nervous system, with either a hot bath or meditation or yoga or stretching. Light exposure. We talked about the normal circadian rhythms of melatonin and cortisol. Melatonin goes up at night. Cortisol shoots up in the morning. So these are natural circadian rhythms of these hormones. And if we are to try to get ourselves into a better, deeper sleep, then it's important to decrease the light during the day. Using blue blockers at night, minimizing screen time will be super helpful. Stress management, again, we're trying to employ our parasympathetic nervous system, our vagus nerve. So chronic stress, people talk about the monkey mind. I can't quiet my mind. Well, it's called a meditation practice for a reason. You're not automatically good at it. You have to practice it over time. And the more that you practice, the better you get at it, meaning the mind goes to that parasympathetic state more easily when it has practiced doing so. So even 5 minutes in the evening before bed, breathing exercises, some journaling or stretching or mindfulness, make it a habit. And these habits help you throughout, they add up over time. They say neurons that fire together wire together. So the more you're doing this, the more easily you get into that state in the future. Sleep environment is super important. So keeping the room temperature cold. It's okay to get under the covers, and get cozy under the covers, but keep the temperature cold. Use blackout curtains or a sleep mask, and try to have it be quiet, whether that means you wear earplugs or you use a white noise machine, whatever you can do to help. I know some people say, well, my partner snores and it becomes problematic. You do what you can do to help yourself. So maybe your partner needs a CPAP machine, or some people sleep in different rooms. I'm not saying, it's whatever you decide is right for you, but, your sleep is important for your health. And when you're healthy, you can help others. All right, caffeine and alcohol. Some people have a genetic predisposition to hanging on to caffeine for a super long time. I am one of those people. So if I have any caffeine after like 11 a.m., it affects my sleep at night. Some people almost can seem to have, an espresso at 10 p.m. and not have a problem. However, if you want to improve your sleep, I recommend not taking caffeine in the afternoon or evening time. Switch to a decaf espresso or decaf tea. And the issue with alcohol is that while it helps you sleep initially because it is a sedative, as it metabolizes away, once the metabolism of the alcohol goes away and the alcohol gets out of your system, it pushes you into a lighter state of sleep, which then can wake you up. So if you're having alcohol with dinner, for example, try to have it earlier in the evening, which is better for sleep anyways, to eat earlier, 2 to 3 hours before, and definitely minimize the intake. Try to not do more than a glass if possible, to improve your sleep quality. Okay, so functional medicine approach. Obviously, we talked about, the modifiable lifestyle factors. When I look at somebody who's having problems with sleep, I have to consider everything. What is the root cause for you? And sometimes we have to do personalized testing. Cortisol testing over like a 4-point cortisol over the course of the day can be quite helpful to show me where we are. Sometimes I can guess where we'll be, but without testing, I can't know for sure. But in general, anti-inflammatory diet, limiting caffeine, sugar, getting exercise, relaxation techniques, stress management, those are the mainstays. I try to not use pills like pharmaceuticals. They have side effects. They are addictive. I don't recommend them. I've seen people on Ambien, sleepwalk off of, downstairs and injure themselves. I mean, I've seen it in the ER. So it's not something that I recommend. But there are other herbals that can potentially be helpful, which we'll talk about in a little bit. Okay, we talked about the sleep hygiene tips, the routine, sleep conducive environment, avoid light stimulants. So natural remedies, melatonin. So melatonin, I mentioned, is the sleep hormone. It can be helpful to get you set in a circadian rhythm. So if you're traveling, melatonin can be quite helpful to take before bed in your new time zone. That can help kind of reset, okay? You don't need much. Some people use melatonin, like a lot of melatonin. Even 0.5 milligrams is probably enough. And there is a theoretical and possibly very real risk of when you're taking too much melatonin, you downregulate your own production. And then when you stop, you have a difficult time getting back. So if you need it for a few days because it's been, you're kind of thrown off, I do recommend using it, but I don't think it's a good idea to take it every single night unless you are like, you know what, I get great sleep when I use it. I don't when I don't use it, and I can't stop. Fine. Sleep is the most important part, and if you need it, that's fine. There are other herbal remedies. Chamomile tea has been shown to be helpful to get you into sleep. Valerian root, lavender, magnesium. That is one of my biggest go-tos. I love magnesium supplementation. And the reason why is that we don't get enough magnesium through our foods usually. And if you are highly stressed or very active, that's probably like 99% of us, then your body burns through magnesium really quickly. So ways to get it, I like, if you happen to be more constipated and you need a little loosening of the stools, let's say, magnesium oxide or magnesium citrate would be what I would recommend. If you're having normal bowel movements, I like magnesium glycinate, and I like it at night, and I like 300 to 400 milligrams. You can do 200 milligrams if you're not super active, but really 300 to 400 milligrams will help muscle relaxation. It will help promote sleep. And the other thing that you can do instead, in addition to oral, is if you draw yourself a warm bath and you put Epsom salts in there, which is magnesium. It gets absorbed through the skin and relaxes your muscles and supplements your magnesium levels. So Epsom salt soaks are fantastic. Highly recommended. Okay, we talked about the lifestyle changes. I know I'm kind of beating a dead horse here. Exercise, manage stress, balance nutrition. Oh, other thing. Some people have to pee a lot. Try to limit, if you're one of those people that has to urinate a bunch in the middle of the night, try to minimize your fluid intake in the evening. If you happen to be awake, if you wake up and you're like, I can't go back to sleep, my mind is racing like crazy, I don't know what to do, and I'm so frustrated, that's going to stimulate your fight or flight response. So what I tell folks is, if you get yourself into a breathing, do a breathing meditation, do a yoga nidra meditation. There are apps for that. Body scan meditation. Basically, you get yourself into a state where you are meditating. And when you notice that you're having these thoughts, including, I can't sleep, you recognize the thought and you release it. You recognize the thought and you release it. And you go back to your breathing, you go back to your body scan. And even if you don't fall asleep, please know that when you get into this deep meditative state, it is almost as good as sleep. Your brain waves are at a theta range, which is the type of cycle that leads to brain health. So that knowledge hopefully will help you not freak out and get into a parasympathetic state and realize, you know what, I might not be asleep, but I'm not destroying my mind and setting myself up for dementia. So hopefully that is a really comforting feeling. It is for me. So conclusion, sleep is critical to overall health. It's important to address sleep issues proactively. Together we can find root causes if you're having issues. Lifestyle and holistic treatments, I think, are always super important. And small changes, little changes make a big difference. So hopefully that was helpful. Let me stop sharing and then see if you guys have any questions. How are we doing with time? We have 15 minutes. So if anybody has any questions. Does anyone want to know about heart rate variability trackers?
Yes.
Okay. So heart rate variability is one way of seeing like sleep quality. And if you happen to wear your watch at night, so heart rate variability is it's on the beat to beat variability between your heartbeats. And it has to do with how your parasympathetic nervous system, how your vagal tone is impacting your your heartbeat. And so basically it's almost like a way of addressing, or not addressing, but looking into your parasympathetic nervous system by seeing your heart rate variability. And sleep, you can kind of judge how your sleep was based on your heart rate variability. So if you get into a nice deep sleep pattern, you are taking good deep breaths in and out, and getting almost into a meditative zone. If you do your heart rate variability while you are meditating, if you are able to get into a really deep meditative zone, the heart rate variability goes up. And so this is a marker of, in a way, what is my internal milieu? How's my stress? How is my body reacting? And you can see if you're about to get sick. Your heart rate variability might drop without you realizing why. And then all of a sudden now you've caught a cold and you're like, oh, okay. I didn't realize I was fighting something. But it can also show you what people notice is that things like alcohol, it will drop your heart rate variability at night. And it's kind of one way of for you, one way of following how your sleep quality is. So a lot of these wearables will do this at night. They will check your heart rate variability at night. Now, if it's something that brings you stress, you shouldn't do it. So no need to have stress over it. But if you're one of those people that really likes data, then I think it's worth looking into.
Kathy, where do we see this on our heart rate monitor? Like I wear a Garmin and it does track my heart rate, right? So like, where would I see that?
Do you have the Garmin app? And also it depends on which, okay. So if you go into the Garmin, do you wear your watch at night while you're sleeping?
Not yet, but now I'm curious to.
Oh, well, that's why it's not doing it. So if you wear it at night, and it's not all the models, it's like the more new models, but if you wear it at night, it will track it.
So when I open the app, I would see under heart rate, like something that says heart variability.
Mm-hmm. HRV, exactly.
HRV. Okay, thank you.
Yeah, you're welcome. And
I use my Apple Watch and you wear it at night, and I have the health app on the phone, and so my heart rate says max 73, low 64, and I guess that would transmute to variability if it were to show it.
So it's not quite that. So it's not a heart rate low versus high. It's a beat to beat change. So, so like, picture like if you're at rest and then you take a breath in and you exhale. Inhale, exhale. So it's a beat to beat variability. It is able to, while you're at rest, not like the difference between your heart rate at rest versus exercise. That's different. This is a beat to beat difference based on your almost like environment. So when you take a deep breath in, your vagus nerve is inhibited. And so your heart rate goes up. And when you exhale, your vagus nerve is stimulated. And so your heart rate goes down. And so even this beat to beat variability based on your respiratory rate will, that's the heart rate variability. People who are on blood pressure medications, that's limited. So your heart rate variability is limited because your heart rate is also affected by blood pressure, and some more than others. Like beta blockers really drop your heart rate variability. So that might not be a very good marker for you if you happen to be on a medicine like that.
Okay, so the Apple Watch doesn't seem to show, unless I'm missing it on
It should. It has, I mean, I don't know the various types of Apple Watches, but I know that Apple Watches, at least the more recent ones, definitely have that option.
Okay.
And they, the other thing that they have is they remove some junk data. Because like when you're wearing a watch like this, if you wiggle, it thinks your heart rate is really high. Because
Oh,
it's an optical sensor, as opposed to some things that have like a chest strap that has, that actually can, doesn't just look at the blood vessels pumping, it actually is monitoring your electrical system. So when it looks at your electrical system, it's much more accurate. And that's why chest straps are more accurate than doing the heart rate on your watch, you know,
okay.
yeah. So, but anyway, so Apple has a way of removing junk data from using its protocol. So I know that it exists. I don't have
Okay.
an Apple Watch, so I can't tell you how to but if you look at it, you know, do a Google and I bet that, you
Yeah,
know,
I'll
I bet you'll be
search.
able to find it.
Okay, thank you.
Yes, you're welcome.
I have two questions.
Hi, Claire.
Hi, Kathy. How are you?
Good.
Good. One, restless leg syndrome and what you can do about that, because I definitely suffer from that. And then two, napping and how that impacts.
Oh, napping.
Sometimes, like when you say don't drink any caffeine after noon, I mean, I can barely stay awake some days. And
Okay, I did not talk about napping. I, you know, it's so funny because I actually meant to talk about napping and show many pictures of Dean sleeping. My husband loves to nap and he naps everywhere and every day at 2 o'clock. It's like, and napping is very healthy. Napping significantly reduces cardiovascular disease risk. I think the number is like 38%. And in men, it's actually even higher. So that's an average across males and females, but like for women it's a little less, and for men it's more in terms of disease risk prevention. So it's super helpful, and it only needs to be like 20 minutes. So when you feel there's a natural dip in your body's cortisol, like after lunch. So if you are feeling sleepy and you are one of those lucky people that doesn't have to be in an office or, you know, working or whatever, take advantage of it. Like sleep. It's fantastic. It's rejuvenating and it's been really helpful. And a lot of societies incorporate it. And, you know, and I wonder, there's always a part of me that wonders, you know, when they look at Mediterranean diets, you know, and they're like, oh, the Mediterranean diet is linked to a much lower incidence of disease risk. Well, one thing that they're not taking into account is also that Mediterranean people take naps. And, you know, and I always wonder how that plays into all of it. You mentioned restless leg. So there are medications like pharmaceuticals for restless legs. I'm a big proponent of like magnesium, rolling, stretching, sauna bathing, hot tub, you know, baths with Epsom salts, and trying to use medications kind of as a last resort, if at all possible. But pharmaceuticals do exist, and if the restless legs are keeping you from enjoying sleep, even if you've tried other things, then you know maybe we try a pharmaceutical at a low dose and see how it works.
Thank you.
Yes, of course. Anything else right now?
I mean, I have done, you've put me on the magnesium, and that definitely helps. I'm like amazed at how much it helps.
Yeah.
It doesn't help all the time. So I'm thinking there's, something going on.
Yeah. And if there's pain associated too, depending on like, what was your workout that day or the day before, that might be part of it as well. I do like sequential compression devices. I use these boots called Air Relax. They sequentially squeeze your muscles from lower to upper and kind of push swelling away and actually help with lymphatic drainage. And I find that they work really, really well for achy legs. So that's something to consider, if you ever want to borrow them sometime, let me know, before you invest in a pair. But they work really well, and we use them multiple times a week.
Wow.
Yeah. All right. Any other?
Kathy, I just have a question. Whenever I hear of treatments for sleep apnea, all I can think of is that awful CPAP thing that one has to wear. Are there, and I mean, I'm not talking diagnosed sleep apnea, but just a snore here and there and breathing that doesn't sound regular from time to time. Are there natural ways of dealing with that before you resort to those equipment things?
Yeah. So actually weight loss, it's hard because it's a vicious cycle. Weight loss. So when you lose weight everywhere. And a lot of sleep apnea has to do with the soft tissues of the back of your throat. So tongue and the soft tissues in the back of your throat. So if you lose weight, then sleep apnea usually gets better. So that's one thing, but that's like takes longer, right? And also sleep apnea leads to weight gain. And so that's a tough one. There are other, kind of like if you've ever seen those breathe right strips that kind of help to open up here, that might be helpful. And it really depends. Some people have a small jaw. There are some dental like applications that you can use, but you'd have to have them specially made that are put into your mouth to try to like open up the back of the airway. The other thing is maybe sleeping a little bit more upright, like a couple of extra pillows to kind of keep your head upright, or sleeping on the side. But those are the main ones I can think of. It's a physical. Sleep apnea is there's central sleep apnea, but we're not talking about central. It's a physical obstruction. When you fall deep asleep, things collapse back and obstruct your airway. So the treatments are usually physical treatments. So yeah.
And have tonsils got anything to do with sleep apnea? For example, people who've had their tonsils out, would they have less sleep apnea?
Yeah, so there's surgery. So yes, so if you've had your tonsils out, if they happen to be very big, then that can help. There's something called a uvulopalato-pharyngoplasty, which means just call it UPPP surgery. They take the back of the throat and they like literally cut out the uvula. It's a very aggressive surgery. Like they removed all the tissues back there to try to make that space more open. I don't think that's a good way to go. I mean, I've seen people have that surgery and still not be better. So anyway, yes, to your point, it can help if your tonsils are super big. Great. Well, thank you for joining me. I think we've gotten right to the end, and I appreciate you guys. It'll be recorded for the rest of you who weren't able to take part. And you could put in the community chat any questions, or individually if you have something specific that is private and you don't want to share with the rest of the group. So thanks so much.
Thank you,
Thanks so much.
Kathy.
Bye. Enjoy.
Thank you so much. Bye.
Bye.